Standard Operating Procedures, Part 3, Screening and Testing. HBI is most known for its free screening and testing services that are often provided in the community at a community partner's site. HBI's community health workers, CHWs, are responsible for identifying and coordinating screening testing opportunities. Usually, there are about 5 HBI staff at a screening or testing event that serves about 40 individuals. Depending on the expected number of community members interested in getting screened and tested, more staff, phlebotomists, and volunteers may be necessary. The next few slides highlight tips for effectively organizing a screening and testing event. Workplace safety guidelines must be observed while at screening and testing events. Standard guidelines for working with or around blood and sharp needles include closed-toes shoes in the event of a needle drop, blood exposure, and working in crowded areas or events. Tie loose hair and secure jewelry to prevent contamination of or with bloodborne materials. Long pants and sleeves are recommended to protect skin during procedures or activities where contact with blood is anticipated. Attire and appearance should also be clean and neat. This reflects on HBI's image. Food and food services should be in a safe distance from screening area to prevent accidents and bloodborne exposures. Additional workplace safety should follow CDC and EPA cleaning and disinfecting guidance. Cleaning and disinfecting public spaces, including your workplace, screening event place, and home, will require you to follow federal, state, tribal, territorial, and local guidance for reopening America. In general, reduce the risk of exposure to infectious diseases by cleaning, disinfecting, and wearing personal protective equipment, PPE, when in public spaces. For the safety of HBI staff, volunteers, and the community members that they serve, it's important to make sure that the following working conditions are met before committing to offering free screening and testing at community events. Specifically, an MOU outlining terms and conditions agreement should be signed. Terms and conditions must include screening and testing stations must be indoor in heated and air conditioning environment for temperature-controlled medical equipment to work properly. Facility has restrooms with indoor plumbing. Organizers have made arrangements for HBI's screening and testing booth to be located near working electrical outlets. 3 tables with 2 chairs for each table to set up stations. For example, registration, blood draw, and results for private education and consultation. Space meets fire marshal's safety guidelines. There are 5 general steps to setting up screening and testing events. Step 1 is to update the screening calendar on the website. Step 2 is packing. Step 3 is setting up at the event, usually arriving 1 hour before the event. Step 4 is assisting with the registration form. And Step 5 is to encourage people to get screened at the event. This is a packing list for the registration station. The next couple slides will include images of the items on this packing list. This is what a tall banner looks like when packed, as well as opened and set up. These are images of the tabletop banners and signs. It includes pictures of the box, as well as when it's fully opened and set up. These are images of what our clipboards look like. These are examples of our educational materials with the PPE kits. These are images of the HBI vests when packed, unpacked, front and back. These are images of the registration form, LabCorp slips, and labels for test tubes. These are images of pens. These are examples of the tablecloth and table runner. This is what Tiger Top tubes look like. This is an example of the trash bags we use. This is what the video photo release waiver form and volunteer forms look like. This is the packing list for the blood draw station. Images of these items can be seen in the next couple of slides. This is what the phlebotomist box looks like. It includes the BD Eclipse 21G needles, green, BD Safety Lock Butterfly, green, BD Safety Lock Butterfly, blue, alcohol prep pads, Band-Aid, fabric, gauze, 2x2, and tourniquets. These are additional images of the supplies, including the alcohol prep pads, Band-Aid, BD clear Vacutainer holders, as well as the 2x2 gauze. These are images of the biohazard bags in small and large. These are images of the germicide wipes, gloves in small and medium, hand sanitizer, and absorbent pads. This is the packing list for the centrifuge spinning or rapid testing station. This is what the centrifuge and test tube holders look like. These are images of the HCV and HIV rapid test kits with paddles, white sticks, and blue tray. This is what the glucose rapid test kits look like. This is what the sharps containers look like. We recommend that you use your cell phone as the timer. There should be at least 4 stations set up at an event. That includes the registration, blood draw and testing, centrifuge spinning and rapid testing station, that's for the blood processing and results, as well as the post-screening counseling or private area. These are examples of what our registration stations have looked like. During the registration process for screenings, we ask that people stay home when they're feeling sick, maintain social distancing, use sneeze guards at the registration tables, frequently wash hands or use alcohol-based, at least 60%, hand sanitizers when soap and water are not available, wear cloth face coverings, avoid touching eyes, nose, and mouth, clean and disinfect frequently touched objects and surface. During the registration process, we also ask that everyone reread the participant section back to the participants to ensure all information is accurate, ensure all information is filled out and legible, rewrite it if necessary, advise participants that only Gmail and Hotmail accounts accept encrypted emails. The reason for testing section needs to also be complete. So check if participants indicate if he or she has been tested for HBV, HCV, HIV. If yes, ask if they know their status. If negative and lifestyle hasn't been changed, there's no need to get retested. If positive, ask why participants want to get retested. Is it because they need additional assistance? If no, screen the participants. Also, initial the statement sections. It must be initialed by participants and cannot proceed without participants' initial. So ensure that participants read that section. The consent section. It must be signed and dated. At no given time should we draw blood or use finger prick before participants sign the consent because of liability issues. If screening for lipid and glucose, then participants must be fasting for at least 6 hours. Note that an electronic registration form may be used in place of the paper form. When labeling the blood test tubes for HCV and HIV reagent tubes, use the adhesive labels. Write the screening ID number, the last name, comma, first name, date of birth, and gender. Make sure that the name and the date of birth are not viewable in public settings, so turn the tube so identifying numbers are not viewable, and refer to the HIPAA guidelines for more information. There's also an online registration option. Community members can call HBI DC and go through the registration process. There are standard greetings and questions to ask, which include, do you know what you're being tested for? Have you been tested for HBV or HCV before? If yes, when? What was the result? Do you have a primary physician? If yes, are you up to date on all your vaccines? Do you know about HBV and HCV? If no, explain risk of HBV and HCV, how it's transmitted, and how to prevent transmission. Provide the link to the electronic registration form and walk through each field if necessary. Once online registration forms are completed, you may offer them a lab slip so that they can go to the nearest LabCorp station, make an appointment, and get screened and tested. It's important for HBI staff to follow up on LabCorp's link to see if test results are ready for download. These are examples of what the phlebotomist blood draw stations look like. There are specific guidelines for the blood draw and testing station. For events that include HBV testing, we'll have at least one phlebotomist on site. The phlebotomist will draw blood that could be used for the HCV and HIV rapid test kits. For events where only HCV and HIV is being offered, CHWs have been trained to administer HCV and HIV rapid tests, which are finger pricks. For blood processing and results, blood drawn by phlebotomists need to be processed in a centrifuge, and only trained individuals can do this. For HCV and HIV rapid tests, it normally takes about 20 minutes to process the results. These are images of what the centrifuge spinning and rapid testing station looks like. And please remember, a private area needs to be secured for the post-screening counseling station. Correct diagnostic and therapeutic decisions rely in part on the accuracy of test results. Adequate patient preparation, specimen collection, and specimen handling are essential prerequisites for accurate test results. The accuracy of test results is dependent on the integrity of specimens. Please follow the following guidelines for temperature control. Also, follow the guidelines for specimen clotting. Make sure to allow for specimen to clot for at least 30 minutes prior to spinning. If the screening event takes place during higher than 80° Fahrenheit temperature, pack an insulated bag to temporarily store specimen until the LabCorp pickup driver arrives. The following is a protocol for LabCorp pickup. Log on to the LabCorp website to select specimen pickup and specify HBI's account. The pickup location will show, and specify in the window will call instructions and type routine pickup from the health fair, providing the address, date, and time, the contact person's name and phone, and press the request button. A confirmation number will appear below under the specimen pickup status. Status will show requested. It is good to call to reconfirm. After calling the phone number provided, you can then text the confirmation number to staff members handling the screening event, if you are not the one on site. There are also alternative LabCorp drop-off options. Please review these options with your supervisor.